Hello everyone, how are you? Welcome to my channel. Some patient with goiter may present with or without thyrotoxic features like this. To know whether a thyroid disease is caused by autoimmune process, we can do some antithyroid autoantibody tests. And that's what I am going to talk about today. So what are antithyroid autoantibodies? Antithyroid autoantibodies are autoantibodies that are directed against one or more component of thyroid gland. The most commonly tested thyroid autoantibodies are anti-TPO antibody or antithyroid peroxidase antibody, anti-thyrotropin or anti-TSH receptor antibody, and anti-thyroglobulin antibody. Thyroid peroxidase is an enzyme which is found in the thyroid gland, and it is involved in the production of the thyroid hormone. When antibody is produced against this thyroid peroxidase enzyme, this is called antithyroid peroxidase antibody or anti-TPO antibody. This is also known as antimicrosomal antibody. Its significance are it is present in 90% cases of Hashimoto thyroiditis and 70% cases of Graves' disease. Interestingly, it can present in 10 to 12% of healthy individuals who are actually not suffering from any disease. But these people have increased risk of thyroid disease in the future. Another important thing is that presence of anti-TPO antibody increases the risk of infertility and miscarriages. But nothing to worry about. This risk can be reduced by levothyroxine treatment to suppress the thyroid stimulating hormone. The next is the TSH receptor antibody or thyrotropin receptor antibody. These antibodies can be of three types: activating type, blocking types, and neutral types. When activating type of antibodies are directed against TSH receptor, there occurs hyperthyroidism. When blocking antibodies are directed against these receptors, there occurs hypothyroidism. And neutral antibodies do not cause any hypo or hyperthyroidism. Anti-TSH antibody is present in 70 to 100% cases of Graves' disease. So this test is very sensitive and specific for diagnosis of Graves' disease. Like anti-TPO antibody, it can also be present in normal individual, but the percentage is lower. It is only 1 to 2% of cases. The next one is the thyroglobulin antibody. Thyroglobulin is a matrix protein that is involved in the production of the thyroid hormone. When antibody is directed against this protein, this is called antithyroglobulin antibody. This antithyroglobulin antibody or thyroglobulin autoantibody is present in 70% of cases of Hashimoto thyroiditis and 30% of cases of Graves' disease. Interestingly, when thyroglobulin antibody is present, then in 99% of cases anti-TPO antibody is also found. Another important thing of clinical significance about thyroglobulin antibody is that it is used for monitoring of thyroid cancer after treatment. So, how to interpret the test result of these autoantibodies? When 3 of the antibodies are negative, then the patient is not suffering from autoimmune thyroid disease. When anti-TPO antibody and anti-thyroglobulin antibody is positive, then it is probably Hashimoto thyroiditis. When anti-TPO antibody and anti-TSH antibody is positive, then it is probably Graves' disease. Another type of thyroid autoantibody has been recently discovered. This is called anti-sodium iodide symporter autoantibody, but not much known about this yet. So in the end, to concise, Graves' disease and Hashimoto thyroiditis are commonly associated with thyroid autoantibodies. Although there is overlap, but commonly presence of anti-TPO antibody indicates Hashimoto thyroiditis, and presence of antithyroid receptor antibody or anti-TSH antibody indicates Graves' disease. I hope you have enjoyed today's session. Thank you for watching. Goodbye.